Hello, my name is Patricia Webley and I'm a specialist orthodontist. I would like to talk to you about early orthodontic treatment for children. Usually orthodontic treatment is carried out when all the permanent teeth are present, usually around the age of 12. But general dentists see children in their practice from an early age and at regular intervals, so they're best placed to monitor these children's growth and development. Early interceptive orthodontic treatment reduces the need for jaw surgery at a later age, reduces the need for extraction of permanent healthy teeth, reduces the possibility of fracture of upper incisors when they're protruded. This is very important to do early treatment when there is space management needed because crowding is present in the dentition. We've all seen children who are teased at school about the appearance of their teeth. You can really increase a child's self-esteem if you do early treatment and monitor the way that they're growing and developing. Dentofacial orthopedics allows the dentist to evaluate the skeletal discrepancy and to guide the eruption of the permanent dentition as the child grows. By treating early, you can utilise the growth in a child rather than leaving it till after puberty when it's very difficult to actually achieve anything. In my experience, parents embrace the idea of early interceptive treatment. They know there's a problem with their child, they can see the crowding, they can see the skeletal discrepancy, and often they're really frustrated because they go to the dentist, they're referred, and then they're told to come back later, sometimes years later, to actually correct the problem. The other advantage of having early interceptive treatment is that should fixed appliances be necessary, they're actually going to be on the child for a shorter period of time. Having traditional orthodontics, where you're actually extracting permanent teeth and then closing the spaces, takes longer than just level and aligning the teeth. To close the spaces often can take from 18 months to 2 years. You have a problem then with the oral hygiene for the patient, possibility of losing some of the brackets and having to replace them, and the bonding isn't so good. So overall, from the oral hygiene point of view and motivation of the patient, it's better to have a shorter treatment time. I speak from personal experience here, as my own children had orthopaedic treatment, dentofacial orthopedics from the age of 6, and didn't actually need to have fixed appliances when they were in the permanent dentition. You often find that when you do this early treatment, fixed appliances are not necessary at that stage. Of course, straight teeth are not the only advantage of having early interceptive treatment. To have the correct jaw alignment is very important. I think we've all seen children where they have dark circles under their eyes due to venous pooling, children who snore at night, children who have continual airway obstruction or have coughs and colds because they're breathing through their mouth rather than through their nose. Now, by developing the maxilla, by correctly repositioning the mandible into the proper position, you're going to actually increase the airway. You're going to make these children who are continually unwell at school actually improve their posture, their breathing, their lack of picking up, if you like, all the coughs and colds that are surrounding them day by day. I have used O Orthodontic Laboratory for over 28 years, both in Germany and the UK, and I must have treated probably a couple of thousand patients using this laboratory and early interceptive treatment. Their appliances are always first class, they always fit, their designs are very good, and the backup from the lab is tremendous. So anybody who's starting out looking at early cases, you will be able to ring the lab and know that you have very good support there. The other thing to mention is compliance. Now, with the younger patient, compliance isn't such an issue as, for example, with the teenager. O have a very good range of designs, sports, motifs that really encourage the children to wear the appliances. The benefits of early interceptive orthodontic treatment are really hard to ignore. First of all, you are going to reduce the likelihood of having jaw surgery at a later age. You're going to reduce the likelihood of having healthy, permanent teeth extracted. You're going to increase the self-esteem for children who have protruding upper anteriors and reduce the possibility of them having fractured them through trauma. You will create a more stable long-term result, and if you need to have fixed appliances at a later stage, if you've had non-extraction, then the length of time of the fixed appliance stage will be shorter, which is beneficial to both clinician and to the patient. If you're a dentist watching this and you'd like some more information about early treatment, please contact 000 Dental Laboratory and they will be able to help you with more information and tell you about courses that are available. If you're a parent watching this and you can recognise some things I've been talking about regarding your own children, please contact the lab and they will be able to put you in touch with a dentist in your area who will be able to help you further. Thank you.